Dr. Natalie Crawford. I'm a board certified OBGYN and RAI. And every day I get asked about what you can do to increase the odds of your embryo sticking or your embryo transfer working. And so today I want to review some of the myths, if they're fact or fiction, and some of the things I want you to know as tips if you're going into an embryo transfer. This channel exists to help educate you about your body and your fertility, and I love you guys for all your support. Please subscribe and follow along. That helps spread our message of fertility education to more people. So let's dive in to what it is I want you to know for your embryo transfer. So fact or fiction, bed rest is important for embryo implantation. This is false, so this is just a myth. And what we know is in no realm is bed rest important, meaning immediately after transfer or during that 2-week wait. So there was actually a study looking at bed rest immediately after implantation. So people had an embryo transfer and one group got up immediately and went to the bathroom. If you've been through a cycle, you know that we like the bladder full for an embryo transfer. This is for two reasons. The bladder, when it's full, pushes the uterus so it's more than a flat line. In the majority of people, the uterus is slightly anteverted or tilted upward, and the bladder is right here. So when the bladder is full, it pushes the uterus, so this is a nice straight pathway. Also, that bladder with the liquid inside makes the sound waves travel through, and we can see a clearer picture inside the uterus, and we can see that lining a lot more clearly. So because your bladder is full, you really want to pee. So group one went to the bathroom right away, got up, moved around. Group two rested for 10 minutes after the embryo transfer. And the group that got up and went to the bathroom had higher pregnancy rates than the group that rested. So this leads us to think, one, there's no need for bed rest. Two, potentially it's harmful. Hypothetically, why? Maybe uterine contractions from that bladder. You know, if you've ever really had to go pee, you can feel spasming or contractions, that inflammation may not be good. And so getting up, going to the bathroom, I will always say embryos implant in the wild while you're up and walking around and living your normal life. Also, there's no reason why you need to abstain from total exercise and be bedridden. One, that's going to increase your risk of a blood clot if you're being on bed rest. We know that with hormone treatment or with pregnancy, that risk increases anyway. But two, it's good for you to stay active. I tell my patients, don't run a marathon. Don't be doing high intensity exercise in this time period. You may be restricted on certain activities if you had a fresh transfer or if you had a modified natural cycle, meaning the ovary grew some eggs, because that could put you at risk for ovarian torsion. But ultimately, I tell my patients, walk, low intensity exercise, lift weights, stay active. That's good for both your mental and your physical health leading into the pregnancy. All right, number two, if you cough or sneeze, the embryo is going to fall out. That's actually false. The embryo is not going to fall out. Remember that the uterus is a potential space. And what that means is it's really collapsed upon itself. We think of it like we see in these pictures, like a triangular cavity with this open space. And if I just put an embryo inside, it's going to fall out. But realistically, if we imagine that it's more like a cup of Jello, and I saw somebody do this analogy once, and you put the embryo inside of it, you could turn the cup upside down. The embryo is going to stay. So once we place that embryo in the lining, it's going to stay there. It's going to actually start to implant really soon if it's a day 5 or 6 embryo. So you can't cough, pee, sneeze it out. There's no level of activity that's going to get it out, not if you have intercourse. So the embryo is in the uterus. You are not going to do anything to cause it not to fall out. Remember that not every embryo is going to work, and that's not your body's fault. That's really just a level of embryo competency, the ability of the cells to divide, the metabolism to be correct. Even in a genetically normal embryo, not every embryo is going to become a baby. We usually see pregnancy rates or live birth rates of around 60 to 70%, even for a genetically normal embryo. So it's not going to fall out. Nothing you're going to do is going to cause the embryo to fall out. All right, number 3, you should eat pineapple core during implantation. This is definitely one of those things in the fertility community that's big. And number 1, pineapple is not going to be bad for you. It does have high levels of vitamin C, which is an antioxidant, and so that's great. The reason why pineapple got this myth is because it has bromelain in the core. And bromelain has some anti-inflammatory and potentially some light blood thinning properties. So with the idea, if the blood is thinner or there's some decreased inflammation, maybe that makes it easier for that embryo to implant and that placenta to grow in to that maternal circulation. There's no study proving this. Pineapple's not going to hurt you. If you hate it, please do not make yourself miserable. If you like pineapple, this is a great time. Specifically, it's the core, not the outer part of the pineapple, but the core. All right, eating McDonald's French fries on the day of the transfer improves pregnancy outcomes. All right, this is a funny IVF myth that really reflects older practice. So that's important to understand. It is based out of something. So the idea with McDonald's French fries is that they're salty. And back before we had really good technology that would allow us to freeze embryos and then do a frozen embryo transfer, which is what the majority of our embryo transfers are now. One issue with IVF is that as you had more eggs, you had higher estrogen, you had a risk for something called ovarian hyperstimulation syndrome. And this is where, because of that high estrogen levels, the liquid or the water component of your blood vessels started to leak out, and you would get this bloating, this what we call third spacing, fluid in your abdomen and your lungs. And this could become very serious. You could get hospitalized, you can have kidney damage, you can get an infection. And so OHSS happened typically after you have a pregnancy over fresh transfer, because the HCG from that pregnancy keeps all of those hormones producing over and over again. And so if you are at risk for OHSS, now we do not do an embryo transfer. We do a freeze-all cycle. There's some other protocol specifics we do as well, but we don't want you to get this. But before embryo freezing was the norm, people who were at risk, if you had salt, salt helps your liquid or the water part of your blood stay in your blood vessels, so you'd be less at risk to third space the fluid. So you would have a lower risk of OHSS or more mild symptoms. And because that gets worse after a transfer, that is when people would eat those McDonald's French fries so they could have that salt load. Same thing with drinking Gatorade when you feel dehydrated. Ultimately, no study proving that helps. It's really more in reference to a fresh transfer or when you have high hormone levels than it is in a frozen transfer. But if you want McDonald's French fries, go for it. That's definitely not going to hurt you. Number 5, you need to eat a Brazil nut every day during the luteal phase. Now, this is an interesting one, and Brazil nuts again go into the category that ultimately are not bad for you, but too much could be. Brazil nuts have selenium in them. Selenium has been shown to have healthy follicles in animal-based studies, and then women who had higher selenium levels had higher implantation rates with IVF, so this is where this came from. That being said, you can have too much, so you don't want to have a handful of Brazil nuts. 1 or 2 a day would be fine. Also, a multivitamin is largely going to have selenium in it as well, so if you are not a fan, this is not something you need to feel inclined that you need to do. Number 6. You need to wear warm socks because cold feet, cold uterus. This actually goes back to the old Chinese medicine adage that a cold uterus or a uterus without good blood supply is one of the reasons why some people don't get pregnant. This is why leaning towards acupuncture with the idea to improve blood flow is potentially beneficial. Now, we know based on acupuncture studies that acupuncture actually helps because it reduces some stress hormones versus improving blood flow. It doesn't hurt. So if you find acupuncture helpful as far as a mental stance or you feel more relaxed afterward, it can be helpful. And we do see improvements in acupuncture studies. But wearing warm fuzzy socks is not going to make a difference. However, why suffer with cold feet? If you want to bring warm fuzzy socks, I love it. I see tons of people wearing the cutest socks on their embryo transfer day. So cold feet does not equal cold uterus. That's not a proven thing. Again, is it going to hurt you to wear cold socks? No, not at all. And lastly, what I want to leave you with is that there's very little you can do, to be honest, that's going to make a difference. The number one reason why embryos don't implant is the embryo itself. And we know that based on studies that are looking at euploid embryos and not changing anything in the protocol except the embryo. And by the 3rd transfer, 95% of people are pregnant. So that means the odds of having recurrent implantation failure is actually very low. I like to say, treat yourself pregnant until proven otherwise, PUPO, meaning once you put that embryo inside, act like you're pregnant. Don't smoke, don't drink, eat healthy, avoid foods with high bacterial contamination, avoid people who are sick. Your immune system drops once you get pregnant. That's because your body can't fight the baby. It needs to allow this embryo to implant, so your immune system has to drop. You're more susceptible to other things. Stay active. Get rest, try to decrease your stress, share with the people who are closest to you who can support you, whichever way that this goes. whether that's an anonymous online community or your best friend or your sister or your mom or a coworker. Having people who are there to support you is one of the top things you can do, because no matter what, IVF can be draining financially, emotionally, physically, and the more of a support system you have, the better you're going to be. I do have a lot of content on preparing you for IVF, so feel free to watch some of those videos to learn more. If you want to ask specific questions about the embryo transfer in the comments, we'll be answering those and going to do another IVF Q&A video coming up soon. As always, you can get more